what about the myth thyroid RFA causes scar tissue in the neck that might make a future neck surgery more difficult?
That is also an important myth to dispel because I understand that it might dissuade people from choosing RFA. I have to say that although I personally haven't had any patients on whom I've operated after they've had RFA, I've had plenty of patients, almost all patients that go to the operating room and they have had fine needle biopsies before they've had a surgery. To some degree, absolutely. Any invasive procedure will create scar tissue. The great thing about RFA is that the scar tissue is created where it's less important, if you will. So many of the things that we as surgeons really want to preserve when we're working around the thyroid are the parathyroid glands and your vocal cord nerve. And those, really both are going to be sort of on the back side of the thyroid where radiofrequency ablation probe, will have never gone.
It's interesting. In the 2 years that I've been doing this, I have not encountered a physician yet who has done a surgery on a patient after having had RFA. So
yeah, I think it's really uncommon. And, the only information that I have is sort of word of mouth from colleagues around the world that have had, and again, it's a really small handful of patients who have been in that circumstance. At least what they've said is there's certainly some scar tissue that is encountered maybe when in the first steps of the surgery, similar to when patients have had, again, like a fine needle biopsy beforehand. But where it really counts, there's no scar tissue because the procedure has stopped short of that area intentionally because we want to protect those structures.